In this video, we will take a look at how drugs interfere with people's ability to consume food adequately, and then we'll take a look at some of the most common food-drug interactions. Medications can have a lot of effects on individuals and how well they consume foods. And even you may have noticed, even taking an antihistamine or a decongestant that might cause you to have a really dry mouth. So various medications can cause nausea and vomiting, can change how foods taste, make your appetite much less, sometimes even cause inflammation in your mouth, make you more tired where you are too drowsy to eat, cause constipation, and in some cases even cause you to eat more food because it stimulates your appetite. So let's take a look at some of the specific food-drug interactions. Some of our medications that are prescribed to individuals can cause some varying effect. For instance, altered stomach acidity. We know that the whole purpose of antacids is to lower acidity in the stomach, and that interferes with specific nutrients. The two most notorious ones are folate and iron. We also know that some of the antibiotics bind up minerals so that those cannot be absorbed. And then we also have a direct inhibition of medication that can interfere directly with the absorption of a nutrient. So one of the medications that we use for gout inhibits B12 absorption. Then we have some dietary effects on how the medications are metabolized. And some medications have very similar structures to a nutrient. So that would compete then for enzymes necessary to either activate or break down the medication and nutrients, so they're interfering with each other. So one of the notorious ones is methotrexate, which is used in cancer treatment, and this one has a similar structure to folate. And so unfortunately the folate is not utilized in the same way, and supplementation is necessary. Then we have some of the additional effects on metabolism, and one of the most common that we see so frequently is this interference with the active components in grapefruit juice that break down or inactivate enzymes that are necessary to metabolize medications that are used for heart treatment. So some of the statins and high blood pressure medication. And they're very specific ones, so these are things that you would look for on the label to find out which ones are a problem. But in those medications, patients do have to avoid grapefruit juice. And then we have vitamin K that interferes with the anticoagulant medications. So patients who are on blood thinners have to keep their consistent intake of vitamin K. Remember, back in the vitamin chapter, we learned that vitamin K is necessary for blood clotting. So this is counteracting effects of blood clotting with vitamin K and an anticoagulant that is trying to thin the blood. So in this situation, we don't avoid vitamin K, but we give them a list of foods that are high in vitamin K, and then we talk to them about how they can be consistent with the intakes, just as they would be consistent with the amount of medication that they're taking. Then we have some additional effects where medications can cause excess excretion of nutrients. And diuretics are well known for this being a problem because diuretics are causing you to urinate out more of your urine. That also comes with many of your electrolytes, including potassium, magnesium, and calcium. Potassium is the one we are the most concerned with. Now, there are some diuretics that are potassium sparing, so you have to note which diuretic the individual is on. But it is enough that it can cause individuals to be too low in their bloodstream with potassium, which is potentially dangerous. So this is an easy fix. It's just one of those things to increase potassium intakes in their foods. And of course, you learned all about those in the earlier part of the semester. And then we have corticosteroids. These are our anti-inflammatory medications, and they cause calcium losses and tend to retain fluid and sodium. These are specific drug nutrients with toxicity. So what happens in this case is that some component within the food increases the action or side effects of a medication. And one that was very, very common back in the day of MAOs being used. And MAOs are still used from time to time, but they're not nearly as popular anymore. So these are monoamine oxidase inhibitors, often used for depression and Parkinson's. So you do have to watch out for these because when a patient is on an MAO inhibitor, they do have to limit their tyramine in foods, which can be commonly found in like aged cheeses, wines, and some meats. That's all for our medication and food interactions. Thank you for watching.